Kayaan Nidibal, Maritiogus Mamans. I won't speak Aboriginal language, but Kayaan is welcome everybody, and thank you for having me. I'd love to talk to you throughout the day. Thank you very much. Welcome.
Good morning and welcome to all of you who have joined us in the room here at Optus Stadium. My name is Richard Choong and I have the pleasure of being Chairman of the Board of WA Primary Health Alliance, and I hope you've noticed our enormous sign out at the back there over the stadium, and to those of you who are joining us remotely. I'd like to take this opportunity to honour the traditional owners of the land upon which we meet, the Whadjuk people of the Noongar Nation and their elders past, present and emerging. So it's my pleasure to open this Better Health Together forum. That tagline, Better Health Together, is very important, and you'll see and hear about it today, but it's very important to the organisation, to the board and to the staff, because that's actually who we are. We do better health, but it's together. This is the first time WA Primary Health Alliance has hosted such an event, and hopefully, based on the success so far, it will continue. So just over 4 years ago, it was a great privilege for me to lead the development of WA Primary Health Alliance as a unique endeavour, bringing together the WA's three primary health networks, or PHNs, as a single organisation. There's no doubt that we have grown rapidly since those early days, and I was just reflecting to some of my colleagues at the organisation that when we signed this up 4 years ago, we had a much, much smaller staff and base than we do today, and it has grown almost exponentially. And congratulations to my CEO and the staff for keeping up with that rate of growth. But PHNs over this time have established themselves both locally and nationally in the health system landscape, all with a similar mission to really improve primary care, or care within outside of hospitals and in the community. In the mid-2018, WA Primary Health Alliance initiated a review of its commissioning activities. And through consultation across the breadth of our external stakeholders, we have together set a clear direction for where WA Primary Health Alliance commissioning approach and processes need to develop into the future. Earlier this year, the Commissioning for Better Health Framework was published, and I think on every table there should be a copy. And today's forum is hosted as part of the program of activities. Throughout the consultation that underpinned the Commissioning for Better Health Framework, we heard from our stakeholders that we need to be more open about the direction the organisation's taking. One of the very reasons why we're all here today. Throughout the agenda today, we hope to set that scene. Our choice of speakers and content reflects our approach to developing our strategic partnerships to better integrate healthcare across the state. Ultimately, our collective goal is to provide seamless and quality primary healthcare to Western Australians where and when they need it. And this requires us to work together with a common goal to deliver a health system that works for the people. This is how we will achieve better health together. My board colleague, Anne Russell-Brown, which is just over there, she will be the forum chair today, and it's my pleasure that I hand over the lectern to Anne. Thank you all so much and enjoy the day.
WAPHA is here for the long haul. We're actually very excited about the ongoing commitment to PHNs at a national level, with continued contracts to the 31 PHNs that exist across Australia, and demonstrating the faith that's been placed by the federal government in primary health networks. And we did have bipartisan support. We didn't think there would be any major changes if there'd been a different election result on Saturday, but I guess there is some continuity for us now in that we won't have to rebrief and deal with minor tweaking. I've actually been very proud to be involved in the development of WAPHA right from the very early days. I was a member of the Fremantle Medicare Local, so you'll remember the previous iterations, GP networks or divisions of GP, the Medicare Locals, when I was asked by that board if I would represent them on a basically a planning group to have a look at how we could apply to have the 3 PHNs managed under one organisational umbrella. I'll be honest with you, I thought we had no chance at all. It seemed like a really big, bold plan to put in a tender for 3 PHNs and say we're going to run them all with one backbone organisation. And when the day that Richard rang me and to tell me the result, I was fully expecting him to say we got 1 or 2, but we didn't get all 3. So it was, I think, exciting and a little bit scary when we were awarded all 3 PHNs and asked to build a governance structure around that. And that's been really hard work. It was an extremely bold vision. It was about alliance, which is the word that's in our title, and it was about making sure that we took responsibility for coming up with a structure that allowed us to connect as broadly as we possibly could across what I refer to as the broad primary health sector. Having been around for a long time, I remember the days when people who are working in homelessness or in drug and alcohol or in income support were not really connected particularly well to the mainstream health service. That health seemed like this strange thing off to the side, and that we treated other parts of an individual but we didn't know much about what was going on with their health. For me, one of the exciting things about what's happening for us here in this state and across Australia is the incredible focus on broadening the concept of primary health, on looking at the social determinants of health, of ensuring that all of us are conscious of a whole being. And I think Teresa's story reminds us that again, that it isn't simply about treating acute health issues, but rather about ensuring that we look at a person as a whole being. So we started again when some of the other PHNs simply took a Medicare local and rebranded it. And that was a huge gamble. It meant a lot of work. We didn't always get it right. There have been some major changes that we've had to undertake along the way in starting with a blank sheet and building up. I think today we feel confident to stand before you and say we've worked hard on getting to a place where we feel that we are much stronger in terms of our understanding of our own role and our ability to share that with you. And I hope that by the end of today, that's one of the things I'd like you to go away with, is that you feel a sense that we are connected, that we have strong plans, and that you're part of them, and that there's a role that you can play to be a partner with us. As you'll learn when Leanne Durrington presents to you shortly, we've had to flex and change quite a lot with changes that have happened out of Canberra. So, as Richard mentioned, we started one size. We're about 3 times that size now, or close on it. We're $100 million worth of funding flowing through. We don't see that money, of course, it's flowing through us, but that's a very large responsibility, and it's not where we started. So we've had to keep learning and changing and moulding our processes and our relationships to suit those changes. Way back at the early stages of forming the Alliance, we decided the values of the organisation would be humility, wisdom, integrity, courage and respect. And we've had to call on every one of those as we've gone through the little trips and stumbles and the ups and downs of forming this organisation. I remember at the board we had quite a discussion about whether humility was an appropriate value for an organisation such as us, setting off with a bold plan. And I remember personally being very pleased that we chose it, because the humbleness that is required for us to all understand we're only a part of the solution, not the whole solution, is terribly important. So the Commissioning for Better Health program, which is the base of why we're here today, reflects that learning from the journey so far and sets a vision for excellence in the future. And progress towards this vision will require more learning and more sharing and more feedback, both from you and from our other stakeholders, to help achieve better health together. One of the strengths highlighted through the consultation that informed the Commissioning for Better Health program was the relationships and purposeful partnerships that have already been established. But relationships are really important. We can't just sign up partnerships and not work on them. We need to be honest with each other. We need to call things that are not working. We need to then be able to say we're prepared to make a change. We might have always done things one way, but if it's not the way that's working and the outcomes are not demonstrated, then we need to be prepared to be able to say, yes, I'm happy to give it a try. And as funders, as commissioners, we need to be open to hearing from you when things that we've set as a program are not quite achieving the results that you hoped for. And then to be able to change those as we go along. Each of you in the room today and online are important to us and to the broad WA health system. And none of us can achieve our full potential without those formal and informal relationships. So we need the contracts, we need the sort of written down arrangements, but we also need to trust each other as people. We need to be prepared to take risks together in order to achieve greater outcomes. And doing that, we are probably in a very unique position here in WA across the state to actually influence changes in the whole health system. I mean, you think about how hard it must be if you're one individual PHN in New South Wales trying to influence the state government. I mean, we are very fortunate that we have a united voice and that we can together take that community voice to both state and federal government. Even more exciting is the role that we're going to be able to play in the recommendations of the Sustainable Health Review. I don't know if you know, but WAPHA has been very involved in the development of that review, and we've actually in fact had Chris Kane, our Director of Policy or General Manager of Policy, sitting on the working group for that, and you know, sort of one day a week I think for a while there we let her go into Royal Street to work on the Sustainable Health Review. So we've been there right at the table. Being at the table is really important. It always makes sense to start by joining in, and even if you feel like you might be in oppositional territory, at least bringing your voice and starting from the beginning to influence what's being thought about. So that the statewide footprint of WAPHA has really been helpful to us in being able to have those influences.